Today we'll hear the stories of individuals who have dedicated their lives to serving others through providing direct services and supports, through program leadership and supervision, through building best practices and evaluating those practices, and for working in our administration and finance teams. They are honorable, they are compassionate, and they're living their lives in such a way as to make a difference.
In terms of looking at the awardees this year, like the ABH membership, it's more than the sum of their parts. Really our field coming together, working together to better meet the needs of individuals, to offer hope, recovery, resiliency for individuals that we serve. And when I look at the ABH membership, that's what I see. All of us collectively working together to make things better.
I sit down with so many providers and hospitals where they talk to me about how behavioral health and mental health especially is a loss for them to provide. And it is our job in the State House and across the Commonwealth to change that narrative. There is nothing losing about taking care of people with behavioral health.
We're putting about $10 million into the ESP system, but only with very clear goals that we're looking to achieve on that, and to be pretty directive about, both on the hospital side and the overall system side, what we are looking to see in an actual system of crisis care.
I've always felt that public health, we have a particular obligation to ensure that we address the needs of people in vulnerable situations, and many times are unable to advocate for themselves. We know that many of the priority populations that we serve at BSAS, which are pregnant and parenting women, recently incarcerated, men of color, and the dually diagnosed folks with mental health and substance use issues, are our priority, and we need to ensure that they receive better and more integrated care. Those efforts start with you and our service providers. You are the unsung people doing the hero's work on the front lines day in and day out, ensuring that those who are often unable to speak for themselves adequately have a voice, have a chance, and have a pathway.
This is what describes you, all of you who are being honored here today. You refuse to accept the status quo. You apply your passion to finding better ways to reach all of the individuals who are so in need of excellent behavioral health. You reach out for partnerships to do your work. We thank you, not just today when you're being specially honored, but each and every day. Because here's what you show us. You show us that treatment can work, that healing can happen, and perhaps the greatest contribution we can all bring is to continue applying the art of the possible.
So congratulations on your achievements. Thank you all for your commitment in supporting recovery, resilience, and empowerment for individuals with behavioral health conditions. I'm happy to be here with you.
The clinical management team collaborated to create an internal assessment tracking system called the Client Assessment Tracking System, or CATS. And if you go, by the end of the day, if you go to our JRI Facebook page, you'll be able to see a very cool video that sort of talks about all the things they do. So that actually will shorten up my speech a little bit, I think, which everyone will appreciate. Their work has enabled JRI to identify trends and concerns to leadership, to our Safe Programs Committee, and individual divisions and programs. And it's led to training, policy development, and changes in practice to improve client outcomes. The thing about outcomes is we've all been talking about them for a number of years, and it's really hard to do. It's hard to have meaningful work that actually connects directly not only to kind of the field, which is sort of what we think about around outcomes, are the approaches that we are using useful and helpful, but we actually can, with the work of these folks, connect it directly back to clients. We can give people individual feedback, clinicians individual feedback about how things are going, whether they're getting better, what sorts of things we're doing right, and what sorts of things, frankly, that we're not doing right. It allows us to do some things that I didn't think we could ever do, and we're now moving that beyond just tracking folks while they're with us, but also tracking folks after they leave JRI. We're looking down the road, we think, 1, 2, 5, 10, 20 years at some point. And that is going to make us I think, a lot better at doing our work collectively, and I know it's something that most of you in the room are interested in. See, I ad-libbed, and that's a problem. The JRI quality management team developed the risk and change indicator, which is the RICL, so we have CATS and RICL, which helps us understand the agency's impact on functional areas. The management of the CAT system is dependent on expertise, talent, passion, and social justice commitment. And it actually is also a sales job, because when you ask hundreds of clinicians and staff to enter data and to report back on what they're doing, they're generally not totally thrilled to be doing that. It's not usually the #1 priority, but what they've been able to do is make that work meaningful and help them connect this collection of an analysis of data to the actual work that they're doing. And in that, there's a sales component to almost everything we do, and these folks are wonderful salespeople. They're kind and caring, and yet really persistent. They won't let anybody go. So the team consists of Susan Ellis, Senior Director of Quality and Compliance, Dr. Leah Martin, Associate Director of Quality Management, Erica Christ, Long-Term Follow-Up Coordinator, and Boshwan Lee, who is a biostatistician, which is my favorite title for anyone. This team at JRI has been building this robust system over the past few years. To our knowledge, there's no other system like this currently anywhere. And if there is, don't tell me. I don't really want to know. I want to keep saying that there. And I'm honored to present the Clinical Data Management Team with this year's Excellence in Outcomes Award.
Thank you. On behalf of myself and my wonderful team and all the data crunching nerds out there, I want to just express my gratitude to ABH for this really wonderful award and the recognition. It really means a lot to our team. But beyond that, I want to actually express our gratitude to everybody at JRI, Andy Pond, Carrie Becerra, Jen Miguel, all the people at JRI who've really just been giving us from the start such tremendous support in pursuing this sometimes dry and not very exciting area of providing behavioral health services. So really just embracing and understanding from the start the importance of collecting clinical data outcomes for providing high quality clinical care and pursuing social justice, and having the vision and the commitment and the patience to allow us to build this really state-of-the-art dynamic clinical outcomes tool that basically we use every day to do the work that we're doing. And now for a little bit of the salesy part, as Andy said. But if anybody's interested in learning more about the CAT system, what it does, how it helps us do the clinical data analytics that we do every day for quality management, we have a table outside, and we'd love to talk to you about what we're doing and how we use the system. So thank you so much.